Pacific Health leader Sir Colin Tukuitonga has been appointed to work for the World Health Organization. After resigning from all New Zealand government groups citing a no confidence, he'll now be chairing the advisory group on the prevention and control of non-communicable diseases. Sir Colin says he'll give advice on how to best manage obesity, diabetes, heart disease and other non-communicable diseases that affect the Māori and Pacific communities disproportionately. He spoke with Alicia Foon about his new role.
It's a strategic group. It doesn't get into the details. It most certainly doesn't get into the budgets. But clearly, a key issue for the group will be about how do we secure finances to make sure that there's enough money for member states of WHO to do the work.
Long term, how can we collectively improve Pacific Health considering we face so many non-communicable diseases?
Yeah, it's a hard one, eh? I mean, if I knew that, I wouldn't be talking to you. I'd be out there making the most of it.
Yeah.
I mean, this is the problem. We've known about diabetes from the 70s, possibly earlier, and we're still struggling with it. And meanwhile, diabetes rates, particularly in the islands, continue to rise. I mean, it's highly unlikely that there's a one single solution, but even so, we are still devoid of things that we know are effective. So that's the challenge. That's why the World Health Organization has set up the scientific and technical group to support her, to provide advice, to try to find out what would work, because so far we haven't found anything that's effective. So it's a big challenge, absolutely.
On a grassroots level, sometimes it can be seen, and we've heard from people, that they don't always know what the WHO or United Nations are doing, because sometimes it can feel like potentially talking heads or people making decisions on their behalf. But at a grassroots level, what strategies and advice will you be making that would directly impact them?
I mean, at a community level, as you say, as a grassroots level, we know already, it's people choosing a healthier diet, people not smoking, reducing salt consumption, getting more physical activity, all of those sorts of things. We know at an intellectual level, the challenge, of course, is how do you support people to do that? And we have some ideas with regard to smoking cessation. We know what works. But there's still an awful lot of people who continue to smoke. In other words, having the knowledge about a risk factor, unhealthy diets, and choosing a healthy diet is very complex. So at one level, it's a simple message that we keep repeating at the national, at the country level, at the individual and family level. But then, of course, beyond that, there are global issues like trade. So people consuming high amounts of processed foods, imported foods, is, again, the domain of global food companies that make and market the stuff. So it's obviously very complex. I do think it's important to get UN-level, WHO-level support, because that's where the political commitments and hopefully translated into resources happen. So you need all of these actions at the individual level, family level, community, nation, region, and global. You need all of those things happening at the same time. So far, of course, it's been difficult because often the power of governments pales into insignificance when you look at the power of Coca-Cola and McDonald's and the big food companies in terms of marketing. The governments, the health departments don't come close to the marketing muscle of the global food company.
How can some of the work that you do truly change the conversation? Can you be involved in campaigns and that sort of thing? What kind of budgeting do you have available to go head-to-head with some of these huge companies? Is that even achievable?
We don't even come close. I mean, I understand, for example, that the total budget of the World Health Organization is less than the budget of the New York Health Department alone. And comparing public health spend from governments to corporate global companies, again, it's not even close. So there's always going to be a mismatch of the resources available to public health entities compared with the private sectors. But, things do work. I mean, you'd be aware that the smoking rates in 14, 15-year-olds in New Zealand is now less than 2%. All kids, all young people, Māori, Pacific, Pākehā. So occasionally you have some wins. Unfortunately, they often takes a very long time, but we do succeed even with a budget mismatch between the public health agencies and the private sector.